Welcome to the People Beating Cancer Pancreatic Cancer Coaching Program. My name is David Emerson. I am the director of People Beating Cancer and a long-term survivor of a blood cancer called multiple myeloma. I would like to take the next 10 or so minutes to describe the Pancreatic Cancer Coaching Program for you. In short, I researched and created this cancer coaching program to address my mantra as a long-term cancer survivor living with a host of long-term and late-stage side effects from my traditional therapies. And that mantra is, I wish I knew then what I know now. I am so confident that this program will satisfy you and your caregivers with evidence-based, actionable information and therapies that I am offering a 30-day money-back guarantee, no questions asked. My goal is to provide each pancreatic cancer patient and caregiver essential information at no risk to him or her. My experience has been that most newly diagnosed cancer patients don't know what they don't know. When I was first diagnosed myself in early '94 with an incurable blood cancer, I knew nothing about my type of cancer. I knew even less about conventional, integrative, and complementary therapies for my cancer. Like most newly diagnosed cancer patients, I spent the first days and weeks after my diagnosis working through my anger, fear, and grief. I assumed my oncologist had my health under control. I was wrong. Please don't misunderstand me. Conventional oncology can be an essential component in the life of every cancer patient. However, I now understand that in order to manage an aggressive cancer, like pancreatic cancer, the newly diagnosed patient must look to all possible forms of evidence-based research and think beyond surgery, chemotherapy, and radiation to manage his or her cancer. Since the launch of People Beating Cancer in June of 2004, I've researched and written about pancreatic cancer extensively. In 2018, I decided to curate and create a specific cancer coaching program for pancreatic cancer patients, survivors, and caregivers. I created the Pancreatic Cancer Program in order to give newly diagnosed pancreatic cancer patients and caregivers the research, information, and experience that I believe they need to manage an incredibly complex and aggressive cancer like pancreatic cancer. Since 2004, I've researched and curated more than 80 articles and studies about pancreatic cancer that, when combined with my own long-term survivor experience, addresses what we all know to be true, that knowledge is power, especially in cancer. The diagnosis of pancreatic cancer requires dozens of life-changing decisions in the days, weeks, and months following the words, "You have cancer." The Pancreatic Cancer Coaching Program gives you the research information and survivor experience that you need broken down into those topics that research indicates will help you fight your cancer. No single guide, no single therapy is a silver bullet cure. The Pancreatic Cancer Program is designed to work as an all-encompassing lifestyle going forward. The 15 guides that make up the Pancreatic Cancer Program are 1. Facts, keywords, and definitions for pancreatic cancer. Let's face it, oncologists use a language all their own. You may need a pancreatic cancer dictionary just to keep up with your oncologist. 2. Key questions for you and your oncologist. Your oncologist, your cancer doctor, is central to your life as a pancreatic cancer patient going forward. You need questions to find the right oncologist for you. The third guide conventional or FDA-approved pancreatic cancer coaching therapies and the challenges that come with them. It's in your interest to get a summary of the best possible surgical, chemotherapy, and radiological regimens now. 4. Therapy-induced short, long-term, and late-stage side effects. Chemotherapy and radiation cause short, long-term, and late-stage side effects. The challenge is to identify them in an effort to minimize or possibly eliminate them from even occurring. 5. Caregiving the pancreatic cancer patient. Cancer caregiving is every bit as difficult as surviving cancer. Learning what the issues are and how to handle them will help you. 6. Pancreatic cancer nutrition. What and how you eat before, during, and after your therapies can have a dramatic impact on your life as a cancer patient. 7. Antioxidants and cancer. Antioxidant nutrition and supplementation can play an important role before, during, and after your therapies. 8. Anti-pancreatic cancer supplements. There are 20 different supplements that research shows can kill your pancreatic cancer. 9. Integrative therapies. Chemotherapy and radiation can be rough on the pancreatic cancer patient. Integrative therapies can increase the efficacy of chemo while reducing its toxicity. 10. Evidence-based, non-conventional, non-traditional pancreatic cancer therapies. You may or may not need to pursue any of these therapies, but you should be knowledgeable about these therapies just in case. 11. Cannabis in the pancreatic cancer patient. Medical marijuana for pancreatic cancer is an important therapy to fight your cancer itself and to helping the patient with side effects such as nausea, muscle wasting, and cachexia. 12. Detoxification in cancer. Pancreatic cancer patients must detoxify as a lifestyle therapy, especially after chemotherapy. 13. Mind-body therapies in cancer. Most people have a general understanding that our mind plays a central role in our physical health. This guide lists specific studies and therapies for the cancer patient. 14. Online pancreatic cancer support. Communicating in real time with other pancreatic cancer survivors is both informational and rewarding. 15. Financial issues in the cancer patient. The last thing I wanted to think about during my own early struggles with my cancer were financial issues. What my insurance covered, why and why not. Don't make the same mistake I did. The People Beating Cancer Pancreatic Cancer Coaching Program is available in either the basic or the premium package. Both the basic and premium programs include all 15 guides as well as my ebook, Managing Cancer, If I Knew Then What I Know Now. The 15 guides are designed to work with the information contained in my ebook. The basic Pancreatic Cancer Coaching Program includes all 15 guides and my ebook. The premium Pancreatic Cancer Coaching Program includes all 15 guides, my ebook, and 6 months of online support with me to answer any and all questions you may have about you, your pancreatic cancer, or the therapies discussed in any of the 15 guides. My guess is that you and your caregivers will have lots of questions about conventional, FDA-approved, and evidence-based, non-conventional issues. The premium pancreatic cancer coaching client can use me as a resource as much or as little as he or she wants. Please remember that the Pancreatic Cancer Coaching Program includes a 30-day money-back guarantee. No risk to you or your loved ones. Please remember that your coupon code is the word webinar. When asked, type the word webinar, WEBINAR, into the box provided. Thank you for your time and good luck.